According to World Health Organization, globally, heart disease kills 17.9 million people each year. That's 32% of all deaths worldwide. According to American Heart Association, in the USA alone, someone dies from cardiovascular disease every 34 seconds. Heart attacks are the #1 killer of both men and women in America. That's right. By the time you finish watching this video, more than 12 people may have suffered one. But don't worry, here's some good news. Survival rates have dramatically improved. In 1970, only about 40% of heart attack patients survived hospitalization. Today, that number is over 90%, thanks to medical advances and public health measures. This drop in mortality is one of modern medicine's greatest success stories. Today, I'm breaking down everything you need to know about heart attacks. What causes them, how to spot the early signs, key differences from cardiac arrest and heart failure, how to prevent them, and what you can do right now to protect your heart. All in just 7 minutes. Let's dive in. A heart attack or myocardial infarction is when blood flow to a part of your heart gets blocked. Your heart muscle needs oxygen to survive. No blood flow, no oxygen. That part of the heart starts to die. It's like a pipe clogging, water can't get through, and the garden withers. Most heart attacks are caused by coronary artery disease, where cholesterol plaque builds up in your arteries. One of those plaques can rupture, forming a clot that blocks the artery. Classic signs and symptoms of heart attack include chest pain or discomfort, feels like pressure, squeezing, or an elephant sitting on your chest, pain radiating to your left arm, jaw, neck, back, or even stomach. Shortness of breath, which can happen with or without chest pain. Cold sweats, breaking out in a clammy sweat. Nausea or vomiting. Lightheadedness or dizziness. Unusual fatigue, especially in women. Women's symptoms are different. Ladies, listen up. You're more likely to have nausea, back pain, jaw pain, and shortness of breath, without chest pain. Many women describe it as feeling like severe indigestion. Let's break down the risk factors you can and cannot control. Non-modifiable risk factors which can't change include age. The risk increases after 45 for men, 55 for women. Gender. Men are at higher risk, but women's risk increases after menopause. Family history. If a parent had heart disease before age 55 for men or 65 for women. Modifiable risk factors which can change include high cholesterol, smoking, diabetes, obesity, physical inactivity, unhealthy diet, stress. Now, let's clear up the confusion between heart attack versus cardiac arrest versus heart failure. 3 terms that people often mix up. Heart attack, caused by a blockage that stops blood flow to the heart muscle. That's what we've been discussing. Cardiac arrest, an electrical problem where the heart suddenly stops beating. This is when someone collapses and isn't breathing normally. It's an immediate life-threatening condition. Heart failure, a chronic condition where the heart isn't pumping blood as well as it should. It's a long-term weakening of the heart muscle. You can think of it this way. A heart attack can lead to heart failure over time, and both conditions can trigger cardiac arrest. If you go to the hospital with suspected heart attack symptoms, here's what doctors will do. Electrocardiogram ECG or EKG. This is the first test done. It measures your heart's electrical activity and can show if a heart attack is happening right now. Blood tests, specifically troponin tests, which measure proteins released when heart muscle is damaged. Echocardiogram, an ultrasound that shows how well your heart is pumping. Stress tests, measures how the heart responds to physical or pharmacological stress. CT coronary angiography, a non-invasive imaging test that uses a combination of X-rays and a computer to create a 3D image of the coronary arteries. Coronary angiography, a special X-ray that shows if your arteries are blocked. The American Heart Association says that 80% of heart attacks are preventable through lifestyle changes. Remember the mnemonic A, B, C, D, E, F, S. A. Avoid tobacco and vaping. Get help to quit. B. Blood pressure control. C. Cholesterol control. Take statins if your risk is high. D. Diabetes prevention or management. E. Exercise 150 minutes a week plus moderate 2-day strength. F. Food, Mediterranean or dash, portion mindful. S. Sleep and stress. Sleep 7 to 9 hours, manage stress, treat sleep apnea. Bonus, Stay up to date on vaccines like flu and COVID. They lower cardiac complications. Heart-healthy foods. Fatty fish, salmon, mackerel, rich in omega-3s. Nuts and seeds, almonds, walnuts, chia seeds. Berries, blueberries, strawberries. Leafy greens, spinach, kale. Whole grains, oats, quinoa. Avocados. Olive oil. Aim is 25 to 30 grams fiber per day. Sodium, ideally 1,500 to 2,000 milligram per day if you have high blood pressure. Fish, 2 servings per week. Foods to limit or avoid. Processed meats, bacon, sausage, deli meats. Fried foods, sugary drinks. Refined carbohydrates, white bread, pastries. Excessive salt. Trans fats, often found in packaged snacks. Simple rule. The closer your food is to nature, the better it is for your heart. Treatment of heart attack include medications, aspirin, beta blockers, statins, blood thinners. Procedures, angioplasty with stent placement opens blocked arteries. Bypass surgery for severe blockages. Cardiac rehabilitation, a supervised program to help recovery. If not treated quickly, heart attacks can lead to serious complications, including heart failure, when the heart can't pump enough blood, arrhythmias, dangerous irregular heartbeats, heart valve problems, where heart valves don't open or close properly, leading to 2 main issues. Stenosis, which is simply known as narrowing, and regurgitation, which is simply known as leaking. Cardiogenic shock, when the heart suddenly can't pump enough blood. Sudden cardiac arrest, happens because of an electrical issue that makes your heart stop beating. Thank you for watching. For more healthy videos, subscribe to our channel.